At Total Rehab, we offer an advanced spinal care program, which is an evidence-based program utilizing what's called a treatment-based classification system. So based on a patient's history findings and exam findings, we're able to classify their type of back pain so that we can most appropriately treat it. And there's a lot of research, especially now, that is the best approach for treating both lower back pain and neck pain.
So most spine pain can be treated conservatively through appropriate activity modification and identifying aggravating factors. However, if pain lingers longer than a week to 10 days, it's best to come in for formal treatment.
Most patients that develop back or neck pain, if they don't go and have any treatment at all, will recover within 2 weeks to maybe as many as 6 weeks. Again, the problem becomes if they don't do any formal treatment to address the underlying stiffness or weakness in their spine, then the likelihood that they'll have another episode or a future episode of back pain is rather high.
Our spinal treatments can restore function and decrease pain and help patients return back to those activities that they once enjoyed.
One of the primary indications whether someone should seek treatment for their back or their neck pain is really how much it impacts their lifestyle. If they're missing out on sleep, they're unable to perform activities that they previously could do, or the pain is rather severe, impacting their lifestyle, then they certainly should get in for some formal treatment. The other thing is, depending on the kind of back pain, manipulation may be appropriate, and that is best done within the first few weeks of their injury or development of pain.
So for injury prevention of the spine, it's best to identify the activities that are aggravating symptoms and avoid those activities. With that said, it's not best to completely rest. It's important to keep a cardiovascular component which promotes tissue healing.
In individuals that have had spinal pain, neck pain, or back pain for a long time, someone that we consider to have chronic spinal pain, there is still some of our therapies in our advanced spinal treatment approach that can be helpful. Often in those instances, it's not realistic to say someone is going to become pain-free after years of pain. At that point, the emphasis becomes improving their quality of life and their level of function to a much larger degree. Probably the two biggest areas where people can develop spinal pain are the amount of sitting they do, either for work or for things that they do at home with hobbies, and also how they lift and how much they lift. So three key recommendations that we give people about lifting is number one, to lift whatever they're lifting slowly. Number two, to keep that object very close to their body. And number three, rather than twisting their body or their spine, to move their feet. Typically, if they'll follow those three recommendations, they can avoid some of the lifting-related injuries. The other primary recommendation that we give for low backs especially, but also for neck pain, is some sort of aerobic exercise program. Usually we prescribe a walking program, but it can also be an exercise equipment or in the swimming pool or some other form of aerobic exercise. But the research has supported that pretty strongly, that if folks are involved with aerobic exercise programs, that helps their back and neck pain. There are some specific things they can do at home to help with their current episode of back pain or to help prevent future episodes. We give specific recommendations with videos and with pictures to our patients so that they'll have a program with them that they can have direct or specific guidance on the kinds of activities they should be doing in order to keep their spine healthy.